So, folks, give me a call, 219-885-1371, if you want to talk about any of the topics that we have addressed today, whether it's abortion, whether it's Big Pharma and their perpetrated fraud in terms of selling SSRIs and other antidepressants to people based on faulty studies. Please give us a call, 219-885-1371. And speaking of Big Pharma and now Big Health, we're going to stay in the health arena. Another study just came out that says that the United States, our nation, could have saved 338,000 lives during the COVID pandemic just in the past 2 years if we did one thing differently. Who wants to guess what that one thing is? Let's have universal health care. That's what it is. If we had universal health care in the United States of America, we could have saved 340,000 lives just in the past 2 years. Just think about that. Now, the study, and it also said we could have saved $105 billion in healthcare costs during this pandemic with a universal healthcare system. Now, more than 1 million people died in this country from COVID, in part because of the country's fragmented and inefficient healthcare system, meaning uninsured or underinsured people face financial barriers that delay diagnosis and exacerbate transmission. Wow. It's almost like people have been telling you for the last, 30, 40, 50 years that the U.S. healthcare system is an abomination. Now, the U.S. had the highest death rate from the virus among any wealthy country, and is also the only one among such countries without universal health care. Let me state that again, that's important. The U.S. had the highest death rate from the virus among large, wealthy countries, and is also the only one among such countries without universal health care. It spends almost twice as much on health care per capita as any other wealthy nation does. Wow. Now, this is according to the Kaiser Family Foundation. No, this is according to, Allison Galvani, who's the director of the Center for Infectious Disease Modeling and Analysis at Yale School for Public Health. She said the current healthcare system in the United States is economically inefficient and leaves millions of Americans without adequate access to medical treatment. Now, the authors of this study recommend that the country adopt Medicare for all, a single-payer healthcare system to facilitate recovery from the ongoing crisis and bolster pandemic preparedness, as well as safeguard well-being and prosperity more broadly. Well, who could have thunk it? Who could have thunk that being the only rich country in the world without universal health care would eventually come back to bite Americans in the ass? You almost got me to curse here. Who could have thunk it? Lots of people. Lots of people. And there was a crazy, wild-haired, bushy-haired man who ran for president twice in 2016 and 2020, who tried to tell all of you that not having a universal healthcare system was going to come back and bite us all in the rear. But the liberal media and the corporate liberal Democratic Party made sure that this man couldn't be president. Now you see why I say that us on the left have to divorce these people. Do not call liberals the left of me. No, not when they purposely slandered and destroyed the opportunity that we had to have universal health care in this country. There are almost 340,000 people dead just in the past 2 years because we don't have what every other rich country in the world has. And the corporate liberals on MSNBC and in the New York Times and the Washington Post, that's owned by the richest human being on the planet, Jeff Bezos, said that Bernie Sanders was a sexist and a racist and all this other nonsense. They literally said that a man who got arrested marching with Martin Luther King Jr. was a white supremacist. They literally said that a man with 100% rating from the pro-choice organizations was a sexist to keep him from getting in office and giving us universal health care. Now you see why I'm so hard on the media and so hard on liberals. This is why. Because we just lost 340 million people, 340,000 people in the last decade, the last 2 years, I'm sorry. I'm so riled up. Boy, this study makes me mad. I'm so riled up right now, I'm sorry. These last few stories have really got my goat, I'll tell you that. Because they both involve big pharma, big health, screwing over the working classes and the poor, and using our suffering, our pain and suffering for their own personal profit and gain. There is no excuse for the United States of America to be the only rich country in the world without a universal health care system. This study even says it. From Yale even says it. Now, to determine how many COVID deaths were potentially preventable, the authors built upon previous studies of the insurance gap and mortality rate in the U.S. with data on how many people lost employer-sponsored insurance due to COVID-related business closures and restrictions that led to employment. Now, while stay-at-home orders and temporary closures of non-essential businesses may have curbed the immediate spread of COVID-19 and prevented catastrophic demands on hospital capacity, the measures also led to spikes in unemployment. For employees, a layoff results in insurance loss. So you see, when you tie our insurance to our job, when we lose our job, what does that mean? We don't have any insurance. Now, the authors calculated potential cost savings from a universal health care program by reviewing the average Medicare and Medicaid cost for a COVID-19 hospitalization that required mechanical ventilation, which were $57,000, $822, and $47,396 respectively, according to the report. The average charge to private insurance was $114,000. Wow. The study also asserts that the fear of losing health insurance during a pandemic might have caused people to go to work every day when they did not feel well. Now, a universal single-payer healthcare system is both fiscally responsible and morally imperative for the U.S. Let me say that again. Universal healthcare system is both fiscally responsible and morally imperative for the U.S. A single-payer healthcare system could prevent such deaths because it would improve access to primary care, which would lead to quicker diagnosis of a virus and better treatment of comorbidities such as diabetes, the study states. Now, Ann Keller, who is a associate professor of health policy and management at the University of California, Berkeley, said that the lack of a single healthcare system is not the only reason the country has high rates of chronic diseases. She also blamed a weak welfare state, poverty, and food deserts. Like we have in this region, food deserts, where the only store around is a dollar store or a gas station, Quickie Mart, where you can buy honey buns and Gatorade, but not fresh vegetables and fresh fruit. But all things being equal, if you provide people with consistent health care, they are able to prevent chronic disease and or manage it once it is present. Again, it's almost like there was an individual who's made out to be crazy for trying to give people universal health care in this country. But the question is, how long are you people going to take this? How long are you people out there going to take this nonsense? Because they need our consent to govern. They do. The powers that be need our consent to govern. They can't govern without us if we don't go along with it. So please, consider this when you go to vote for whoever you vote for in the near future. All right, folks, I got to go to another break. Got to pay more bills. Yes. But we'll be right back with a story that may get me disappeared. I don't know. I think all these stories may get me disappeared. So, make sure you're listening real good now, because I might not be here next week. We'll be back. We're going to talk about the CIA when I get back.